லேட்டா எழுந்துக்கிறனால I don't feel hungry in the morning, so I'll just skip breakfast. டாக்டர் முன்னாடி எனக்கு சுகர் இல்லை, எனக்கு கோவிட் வந்துச்சு ரீசெண்டாக, அது அப்புறம் தான் சுகர் இருக்குது. What are the complications of diabetes and which organs get affected mostly because of diabetes? The complications of diabetes can be divided as acute complications and chronic complications. What is juvenile diabetes? Vanakkam, I am Dr. Smitha, consultant internal medicine, diabetology and lifestyle medicine physician. I work at SIMS Hospital-Vadapalani. பிரேக்ஃபாஸ்ட் சாப்பிடாத ஸ்கிப் பண்ணுறதுனால நிறைய பேர் யோசிப்பாங்க, கொஞ்சம் கேலரிஸ் சேவ் பண்ணிக்கலாம், நாங்கள் மத்தியானம் நைட் மட்டும் சாப்பிட்டுக்கலாம், நான் லேட்டாக எழுந்துக்கிறனால I don't feel hungry in the morning, so I'll just skip breakfast. But you should not skip breakfast because breakfast is a very important meal of the day. It gives us the energy and it makes us more awake. Like from sleep, when we get up, we need some carbohydrates to energize our brain. So we have to have a good breakfast, healthy breakfast. It's not like have a heavy breakfast, but at least minimal quantity. You can have some fruit or you can have some oats or something like that. In any small quantity is better. Skipping breakfast is not at all advised for diabetic patients because they can have low sugars, and skipping any of the meals is not advised. We should always, for any diabetic person, they should have a well balanced diet, and it should not be like according to their own whims and fancies. If they are taking breakfast, lunch and dinner, it should be a balanced diet. It should not be like one dinner is very heavy and we are taking lot of carbohydrates, so like I am skipping the lunch, something like that. So try and have a balanced meal pattern. Lot of youngsters have some of the issues like binge eating or overeating. When these cravings are there, they should try and divert their mind to other things, maybe their work, or when they are and at that time try and take some food which is low calorie, but it is nutrient dense. Maybe take, instead of taking some chips or something, take an apple, so that you can have something also, you can suppress your appetite, but you can reduce the calories. If they are continuously having problems like always thinking about food, they should take help from a psychologist or something to prevent this kind of binge eating. What are the complications of diabetes and which organs get affected mostly because of diabetes? This is the most common question asked by patients. Pre-diabetes, usually when we find out a person is pre-diabetic, and we can bring them to normal or prevent them from becoming diabetic, these complications can be avoided. These complications can be avoided even when a patient who is early diabetic, recently diagnosed diabetic. The most important organs which can get affected is eye. They can have something called as retinopathy. It can be both proliferative retinopathy or non-proliferative retinopathy. They can have vitreous hemorrhage, they can have retinal detachment, and sometimes even have loss of vision. The other most important organ which gets affected is cardiovascular system. In cardiovascular system, the atherosclerosis compared to general population is more in diabetic people. Diabetes makes the atherosclerosis very progressive, so they can have coronary artery disease, they can present with myocardial infarctions, heart failure, and they can also have dilated diabetic cardiomyopathy. The other most important organ which gets affected is kidney. All over we have seen that diabetes is the most common cause for end stage renal disease, chronic kidney disease, which is most important cause for dialysis. So if we treat diabetes, control diabetes in earlier stages, we can prevent them from going for chronic kidney disease, we can prevent strokes, we can prevent even peripheral vascular disease, which in turn leads to gangrene or diabetic foot and some complications like Charcot's foot. There are other complications also like gastropathy. It is called as diabetic gastropathy, where the digestion gets affected, there will be stasis, and there is also men can have erectile dysfunction also, and they can have some complications in the urinary bladder, which is also called as diabetic cystopathy. Progressive atherosclerosis can also lead to vascular dementia. The complications of diabetes can be divided as acute complications and chronic complications. இப்போ acute complications ன்னு பார்த்தோம்னா hypoglycemia. எப்போ hypoglycemia ன்னு சொல்லுவோம்னா when the blood sugar is less than 70 milligram per deciliter. That time அப்போ என்ன symptoms வரலாம். So any patient who is diabetic should be aware of what is hypoglycemia. Low sugar னா என்ன, அப்போ என்ன symptoms வரும் நமக்கு. So that even their family should be aware. What symptoms they can have is படபடனே இருக்கலாம், வேத்து போகிற மாதிரி இருக்கலாம், they may feel giddiness and sometimes extreme tiredness also they may feel. When the sugars are very low like 30 or not detectable in glucometer, that time the patient will be drowsy or he can even have loss of consciousness. These are the symptoms the family and the patient should be very much aware of, and that time they should immediately be treated with glucose, or they should, if the patient is unconscious or drowsy, should be immediately brought to hospital. The other complication which we see most common is high sugars, that is called as diabetic ketoacidosis, where the blood sugars can be even up to 400, 500 like that, and they will have life threatening problems like they can develop breathing difficulty, vomiting, they can be drowsy, and acid production in their body is more. That time also they have to immediately be brought to hospital and treated in the hospital. These are the two main acute complications. Coming to the chronic complications, they are again the retinopathy, where the eye gets affected, non-proliferative diabetic retinopathy, proliferative diabetic retinopathy, and sometimes vision loss. There can be neuropathy, where there is burning sensation of both feet and soles, feet and hands. This is called as polyneuropathy. Increase in blood sugars can affect any of the nerves. It can be a mononeuropathy, polyneuropathy, it can be a sensory or motor. It can also lead to vascular dementia, stroke, and the heart there will be myocardial infarction and coronary artery diseases. What is juvenile diabetes? The word juvenile means prepubertal or young children. Actually this classification is no longer followed. Instead of calling it as juvenile diabetes, we call it as type 1 diabetes, where it is based on the pathology. Here the type 1 diabetes, this can affect even a neonate, that is baby who is less than 1 year old, or a toddler, or young children, and even young adults. Here the main problem is insulin is not produced in the pancreas by beta cells. It can be because of beta cell destruction or dysfunction. This happens because of autoimmunity, that is our own cells act, antibodies act against the beta cells in the pancreas, which lead to diabetes. Coming to the symptoms of juvenile diabetes. If the child is having excessive thirst, drinking water lot of times, that is also called as polydipsia or polyuria. Polyuria is increased frequency of micturition, and polyphagia, that is they eat a lot but they do not gain weight, they are losing weight, they feel tired, they may not be gaining the height, they will not be able to grow compared to their peers. So these are the symptoms where we can find out and get the blood tested, so that any juvenile diabetes or type 1 diabetes we are suspecting. And there are some other tests which can find out, like insulin, fasting insulin, C-peptide, fasting C-peptide. These values also will help us to confirm whether it is type 1 diabetes mellitus, and the treatment has to be given mostly with insulin. Here the oral diabetic drugs, anti-diabetic drugs will not be of any help. So now COVID and diabetes. So lot of questions, lot of doubts in patients mind. டாக்டர் முன்னாடி எனக்கு சுகர் இல்லை, எனக்கு கோவிட் வந்துச்சு ரீசெண்டாக, அது அப்புறம் தான் சுகர் இருக்குது, கோவிட்னால இப்போ எனக்கு சுகர் வந்துச்சா? எஸ், தெர் இஸ் அ பாசிபிலிட்டி தட் மெனி பேஷண்ட்ஸ் who have got COVID, who were maybe pre-diabetes ரேஞ்சில் இருந்திருக்கலாம், அவங்க இல்லை டயபெட்டிஸ் கூட இருந்திருக்கலாம், பட் தெரியாத டிடெக்ட் பண்ணாத இருந்திருக்கலாம், இல்லை டயபெட்டிஸ் இல்லாத கூட இருந்திருக்கலாம், but COVID treatment sometimes oxygen requirement, when COVID had become very sick, the patient would have become very sick and may have got some steroids for a long term. Steroids nariya long term use pannirkumbodhu it would have precipitated the diabetes. So, this diabetes again is only maybe mostly it will be temporary, and after some days they will be able to recover. After the steroids are stopped, the sugars mostly will come down and they can lead their normal life. But some patients, when the COVID would have been very sick, the COVID would have affected the pancreas also, that is the beta cells which produce the insulin, that would have got affected. So, the insulin production, the beta cell dysfunction would have started, which also leads to diabetes. So, post COVID there are many patients who have got diabetes. The other question is, doctor, I am a diabetic, can I get COVID? Yes, diabetic people are very much prone to get COVID because their immunity level is low. As it is, diabetes is a immune suppressive state and solvo. Immune suppression na the immunity in our body reduces because of diabetes mellitus. இந்த மாதிரி பேஷண்ட்ஸுக்கு நம்ம ஜென்ரல் பாப்புலேஷனோட கம்பேர் பண்ணும்போது they are more prone to get COVID, and the disease, the complications of COVID are more compared to general population. இப்போ ஒரு நார்மல் யங்ஸ்டர்ஸ்க்கு ஒரு 25-year-old person without diabetes இருக்கிறவங்களுக்கு ஒரு கோவிட் வந்துச்சுன்னா இட் மேபி ஜஸ்ட் லைக் அ ஃப்ளூ, ஒரு 3-4 days ஃபீவர் இருந்துட்டு போயிடலாம், எதுவுமே அவங்களுக்கு ஆக்சிஜன் ப்ரீத்திங் டிஃபிகல்ட்டி இல்லாத இருக்கலாம், they may not require oxygen. பட் அதே ஒரு டைப் 1 டயபெட்டிஸ் பேஷண்ட்டுக்கு 25-year-old பர்சனுக்கு கோவிட் வந்துச்சுன்னா his lung involvement may be very bad, he may be requiring oxygen and he may have other complications like secondary infections kuda varala. So, the complications of COVID in a diabetic patient are very much higher compared to general population.